Good morning, I'm Adam Sexton. As society has slowly but surely reopened amid the pandemic, more and more people are finding themselves on the front lines of this crisis. One group that's going to become a focal point in the weeks ahead, school nurses. Connecting with us this morning are Kathy Barth, a recent past president of the New Hampshire School Nurses Association, and Pamela Clay Storm, a school nurse at Kennett High School. Thank you so much for joining us this morning, ladies.
Good morning.
So Kathy, school nurses are about to face the challenge of a lifetime, and I think it's safe to say that nurses are generally some of the most caring and capable people you're going to find in healthcare. For many, it's not just a job, but a calling and a vocation. But how are nurses going to hold up amid the magnitude of this back-to-school process?
I think school nurses have been working hard all summer, and they're preparing for this responsibility of getting their students back to school. They're professionally prepared to manage what they're facing, I think, this fall. And, they're using evidence-based resources to make decisions. And I think they're in a good position to help get children back.
And Pamela, you're at Kennett High School. Explain for us, what do you expect an average day to look like when you go back? Do you think you're going to be just triaging fevers basically all day long?
Well, I certainly don't think that would be our expectation. We have a very strong plan and are very fortunate that our district has spent several months developing a plan that implements prevention measures and focuses on that. Our goal certainly is to minimize the risk of COVID-19 transmission in our school setting. So we will have practices in place, including screening procedures that hopefully will help limit ill students arriving at school and staff. And certainly we are preparing for what our day will look like as school nurses. We're developing protocols to address if a student does develop symptoms while here during the school day. And the New Hampshire School Nurses Association has just released a pretty comprehensive guideline, which I think is really going to help us in developing those protocols, a best practice guideline. So that is a support document, and I think that's really going to help all schools and school nurses face that very challenging question of what is our day going to look like.
And Kathy, school nurse offices, facilities, it's not always the most state-of-the-art location. People make the best of what they have. But the physical space issue, do you think that's going to be something that has to be addressed, or in terms of sometimes the numbers are probably going to be higher than what you would see in an average day?
Absolutely. The Department of Health and Human Services has given us guidance on having what we're calling an isolation room space. So school nurses are asking their administration for extra space beyond their health office. So if they have anybody in school, whether it's a student or staff, who has symptoms like a fever or a cold symptoms or flu symptoms that could be COVID related, they will screen them and care for them in the isolation space separate from the healthy school population, which also needs to be managed by school nurses during the school day. So the idea is to separate healthy students from sick students, and to care for these sick students separately, and to have parents come quickly and take them home as soon as possible, so that you're separating them from the healthy population at school. And the same for staff. If you have a sick staff person, they would also go to that isolation space and leave school as soon as possible.
What about the personal perspective here, Pamela? How do you feel on a personal level about your own health coming back into this situation when the problems are going to be coming to you?
Yeah, well, thank you for asking that. I feel fairly confident that, again, if we can put our prevention measures into place and implement them robustly, that school nurses will be using the appropriate PPE, or personal protective equipment, to keep ourselves safe during the school day. And certainly that is not far off from a nursing function. We have been exposed during our school days in the past to a variety of viruses and illnesses. So we are prepared, I think, as nurses to take that challenge on. I certainly would say that individuals, including school nurses, who may be in a more vulnerable population, so they may have underlying medical conditions that might put them at higher risk for severe disease, well, that would be an individual issue that would have to be addressed by each school district and that person with their healthcare provider. But in general, I think school nurses, if we have the proper PPE, will be capable of managing our student population as they present to us during the day.
And just to follow up for you there, you say, if the proper PPE is there, I'm guessing that's there for now. Is the question going to be how long that will continue in terms of supply?
Well, I think as we've watched, across the country, there's been supply chain issues at times. I think there is a strong movement in our state to acquire the appropriate resources, and I know that in my school district in particular, they have been working hard over the summer to make sure we have the supplies we need to protect ourselves. I do think it's important for people to understand the difference between what we say PPE and cloth face covering. So, it's really important to understand that PPE is a specific type of protection measure. A cloth face covering is really about source control. So those are sort of two different things, and I think that is important, Adam, for listeners to understand that when we talk about PPE, we're talking about personal protective equipment for individuals who might be caring for someone who could potentially be ill with COVID-19.
Right, the face shields, the gowns, the N95 masks, are going to be crucial for those school nurses. So, Kathy, in the school nursing guidance that's issued, there was something that caught my eye. I was reading here. It says, quote, siblings of students who are undergoing testing for mild, non-specific symptoms do not need to be excluded from school. Siblings of students who are undergoing testing for highly suspect symptoms should be excluded from school. What's the difference between that sort of non-specific mild symptom and highly suspect, especially when we know there are such a wide range of COVID-19 symptoms and severities?
Right. That's a really good question. The school nurses, I think, know their students very well. And if they have, for example, a student who typically shows up with a sore throat and a headache on a regular basis, that would be someone who I would consider a lower symptom or a lower level of concern, and that student would go home. But if we had a student with a chronic health condition who showed up with new symptoms or symptoms that are on a higher, more severe level, that would be a higher level of concern. And so I'm not going to send a sibling of a child home who I might see often with a headache or a sore throat or fatigue, whereas someone who shows up with new symptoms that I'm worried about, that would be the sibling that we might choose to send home until we get some COVID test results.
And Pamela, how important is it going to be to reinforce for these parents that a fever or any of the symptoms where you might normally say, well, tough it out today, kid, that means staying home this time around?
Yes, I think education and training for all of our students, family, and staff are at the key of our success for the school year coming up. So I believe that getting those messages out to families often, that, keeping your child home when they're feeling ill is going to be even more important this school year. It is a message that schools send home, prior to COVID-19, but we are certainly going to be stressing the importance of that for this particular situation.
And Kathy, we're putting such huge demands as a society on your profession right now, whether it's in the hospital or the school setting. And we know the depth of the workforce has always been an issue in terms of COVID-19. When we saw that first wave in New York, it was just the sheer number of nurses, of professionals that were needed to address the situation. There tends to be only one school nurse. How does it work when the school nurse may have to go home, or there may be an issue there and you're the only one?
Yeah, that could be a challenge. We do have a shortage of subs for school nurses in the state of New Hampshire. So that is a concern. But what Pam said is really important. This protocol that we've put together for school nurses with specific guidance for the health office does talk about that PPE. And if school nurses suspect that a student has COVID-19, it's really important for them to don the gloves, the gown, the face shield, and the face mask for that extra protection. Because if you have all of that equipment on, you're minimizing your exposure to the sick individual and perhaps would not have to stay home in quarantine for 14 days, which is how that is managed in the healthcare system in the hospitals. If full PPE is on, there isn't a concern for exposure. As there would be if you did not put on the full PPE if you had a student who did present with symptoms. That might warrant a school nurse to be home for 2 weeks, and that could provide a shortage in the school of whether there's a school nurse there or not on that particular day, and it might put the burden onto someone else to do health screenings and manage illness in the school setting.
There's the virus, and then there's a lot of anxiety. Pamela, how do you plan to deal with students who may not be sick or ever get sick but are so anxious about this?
Right. I'm glad you brought that up. I think that's a piece of the puzzle that is going to have to be a primary focus for all of our schools, the social, emotional well-being of our students and our families. We are all in this together, and I think we have the ability to provide those resources and that supportive environment for students as they return to our school. But it is going to have to be a focus of our school year, is helping to manage those concerns and the anxiety that certainly the unknown of what this school year will look like might be provoking in our students and our families.
And Kathy, how about you? You're at the elementary school level as we wrap up here on the segment. If you can just quickly tell us, this is going to be scary for kids in some ways, isn't it?
Well, it's scary for kids, it's scary for teachers and for parents, for everybody who's involved in the school. So communication is really important. The education piece that Pam talked about, helping families to understand how their child is safely going to come to school, how we'd manage instances in the school setting if someone is sick, and to really do the best we can to prepare and mitigate for COVID-19 in the schools is really what's going to enable us to keep schools open. And I think I would just stress, for everyone to listen to the advice of wearing a mask, practicing social distancing when you're out in the community, because what happens out there does impact our schools. And if we're going to keep schools open, we need to have a community-wide effort to manage COVID-19.
All right, Kathy Barth and Pamela Clay-Storm, thank you so much for joining us on Close Up. And I think we all want to sincerely wish you the best of luck in this school year ahead.
Thank you.
Thank you.
All right, have a great Sunday.